Miles Prince here, and a week's gone by since I last spoke to you. As I mentioned last week, I'm a board member and founder of Snowdome. Snowdome is a not-for-profit organisation which mission is to accelerate new treatments to patients with blood cancers, and the foundation is focused on getting the best treatment to patients. So one of the key issues is the COVID-19 and how it's impacted on patients' treatment. And so I've been asked frequently over the week to talk to people about what's in their minds at the moment. And the sorts of words are anxiety, how long is this going to last for, how does it affect my family, how do I rate my risk? And I think the theme throughout all of this is that we have to be resilient, because this is going to be with us for a while. I think one of the key things that we need to recognise is, where do we fit in the world? I think the Victorian government has handled this extremely well. The Australian government has handled it extremely well. The issue is, how do we flatten this curve and not have an explosion of cases? And I think one of the advantages that we have here in Australia is that we have a large catchment area of 5 million in, say, Victoria, but we have a large number of hospitals of over 10 major hospitals that will be able to distribute the management of patients with COVID-19. And I'm hopeful that with that distribution, it is going to be easier to manage the rest of the patient population, i.e. you, patients with blood cancers. So although we're watching the overseas situation very carefully and learning a lot about how do we interact with patients, at the same time, I think we are managing a scenario where we are going to be able to continue managing patients with blood cancers, because in other places around the world, blood cancers and other cancer therapies has had to stop to allow patients with COVID-19 to be treated. I don't think that's happening in Australia, and I think you should all feel very comfortable that coming to the hospital to have your treatment is still a safe place. You will be alerted if it no longer becomes a safe place. All precautions are being put in across the board, and so people are being screened, temperatures checked, questionnaires, etc. If you need your therapy, then you need to come into the hospital. Treatments are being delayed as needed, and in a general sense, some of the big procedures that continue to be delayed are bone marrow transplants, particularly allogeneic transplants, autologous transplants, particularly ones that are can be delayed for a period of time. So that, for example, could be an autologous transplant for myeloma. I last night was having discussions with the PBAC, that's the pharmaceutical benefits, about the opportunities of getting drugs that will bide some time. So ongoing Velcade or ongoing lenalidomide for patients who may be delayed for their transplant, to keep them in a, inverted commas, holding pattern. So the government is thinking seriously about the practicalities of how to manage patients. So transplantation is a key area that's been affected. What about other treatments? Well, if you look at the various diseases, multiple myeloma, again, treatments that are involving patients to come into hospital, doctors are frequently looking at, is there alternatives to minimise the burden both on the patient and the hospital system, and choosing oral agents over other agents. The use of intravenous immunoglobulin has been asked by a number of people. That is a supplement of antibody therapies. That is being used a lot. It won't directly protect people from COVID-19, but it will help stimulate the immune system. So if your doctor's talking to you about how is your immune system weak, then the use of intravenous immunoglobulin may be of benefit. The other areas that are important to recognise are the use of other prophylactic antibiotics, for example, to reduce the risks of other infections. And now this is flu time of year. People can still get the flu. So get your flu vaccine. It's available and it should be given as soon as possible. Last week I talked about the concept of this being a public health issue, and it's still very true. A lot of the issues at the moment are around public health, and we are going to have a lot more cases in the next 4 to 6 weeks of COVID-19 running into May. That's going to put a lot of stress on the resources of the hospital, and so it's all about trying to keep things as simple as possible for the next few weeks, but looking at how you're going to manage things for the rest of the year. Some specific questions that have been asked is, when is it getting safer from the point of view of completion of treatment? Well, that does vary from patient to patient. So as a general rule, if you've stopped your treatment for lymphoma or myeloma and have not had treatment, you're probably still at relatively increased risk for at least the first 3 months. By the time we start looking at 6 to 9 to 12 months, that risk is much less. So I would be talking to your doctor directly, but recognizing that the further you've gone from finishing your treatment, the better your immune system will be. As a general rule, don't be scared. This is a scenario with most patients with blood cancers. If they follow the advice of what the government is giving, and following all the various procedures that your doctor is telling you, then it is safe for you on a day-to-day basis. What really puts people at risk are other comorbidities. So the elderly, heart disease, lung disease, kidney disease, they're all important in the general community. So blood cancer patients that are at risk are those that have had very intensive therapies. The diseases that are at less risk are patients who've never had treatment, low-grade blood disorders that continue to be monitored, particularly patients who've not had treatment. It's very hard to be specific for each individual patient, but myeloproliferative diseases, essential thrombocytosis, polycythemia, not at very high risk because it's not affecting the lymphocyte part of the disease. Patients that have had immune suppressive therapies or treatments for strong treatments for CLL or myeloma are at risk, and you need to speak to your doctor. But again, the risk for most patients is relatively small. Lymphoma, it depends on where you are in the course. If you've completed treatment, recovered well, again, you'll be considered at relatively low risk. Again, I stress, please go and have your flu shot. Speak to your doctor. Don't be scared. Recognize that you do need to be resilient. It is important for you to continue to do all the things that you're currently doing. Don't stop doing them because you get tired and get sick of doing it. It's important that we reduce the spread of this infection, but in general terms, we're doing extremely well. And hopefully in a week's time, I'll be able to bring you more good news, because I think what everybody is doing out there is having an effect on flattening that curve. And, I'm confident we are going to get through this. So please, if you have any questions that are specific about your condition, the questions that we've got through the week have been excellent. Please let us know. Let Snowdon know. We'll try to answer them in a week. And please don't be afraid of going to the hospitals. They're there to protect you. And I've just had a piece of paper put in front of me which says, yes, if you have enjoyed the presentation, give us a thumbs up and let us know whether you want to do it next week. Hopefully see you next week. Thank you.